We today launched the largest tuberculosis screening campaign yet ever seen in South Africa. We do so because our country, our beloved country, South Africa, carries the greatest burden of TB in the world. We are, in fact, the third country that carries the largest burden. We do this because reducing TB will sustainably strengthen our fight against HIV and will contribute to building a healthier nation amongst our people. Everyone should know if they have tuberculosis. As we commemorate World TB Day, we must resolve to end ignorance, to stop the spread of TB and prevent the avoidable loss of life. We are here in Klerksdorp because it is in a part of the country that is among those hardest hit by tuberculosis. With its history as a gold mining town, Klerksdorp joins many other towns where the risk of contracting TB is at its highest level. This community is also at the heart of a remarkable, inspiring story of hope that shows that tuberculosis can be beaten. Today, as we summon the nation to support and participate in this groundbreaking TB testing campaign, we must remind one another that to have tuberculosis is not a shame. We must stand firm against prejudice. We must stand firm against those who ostracize people who have TB. We must stand firm against stigma. We must stand firm against those who exclude people with TB. The formal launch of our screening campaign is a response to South Africa's high burden of TB. Our incidence is the highest among the 22 countries currently responsible for 80% of the world's total TB burden. The Statistician General reported in 2014 that TB remained the #1 killer of South Africans. TB is not only the #1 killer of South Africans, but it is also the silent killer of many of our people. We are part of a global campaign to focus national responses on key populations and vulnerable groups with an elevated risk of TB infection. It is important that TB patients on treatment adhere and complete their treatment as prescribed by health workers. The fight against tuberculosis should not and cannot be fought by government alone. We call upon our many mining companies to join the fight against tuberculosis, to join hands with our government so that together we can fight this disease. And with these interventions, we aim to achieve the World Health Organization's 2025 annual targets by reducing TB incidents to less than 150,000 infections compared to more than 400,000 currently. We can do this. We aim to do it, and working together we can reduce tuberculosis infections. We aim to reduce TB deaths to less than 20,000 compared to more than 120,000 currently. We've made great strides in our efforts to overcome HIV and AIDS. We have mobilized millions of South Africans to test regularly for HIV. We have initiated nearly 3 million people on antiretroviral treatment. And we are going to be increasing that number. And that is the commitment of this government. Now is the time to do the same to stop TB. Now is the time to get screened for tuberculosis. This is the time when we must defeat this disease. Ke yona nako e re tshwanetseng gore re tlhole bolwetse bo.